Hi, I'm Sarah Rickard and I'm the Network Manager, and I'm going to share how the power of the networks have helped transform stroke and neurorehabilitation services in our area over the last decade. So the networks were born as separate entities in 2015 under the auspices of the Strategic Clinical Network, and NHS England was so impressed with what we were doing in stroke that in 2020 they created 19 other versions, and we became an integrated stroke delivery network working alongside the Neuro Network. And then in 2021 the networks were merged together and became the network that we are today. So our vision is to support the development of high quality and, importantly, equitable stroke and neuro rehabilitation services. And we do that through quality improvement, working very collaboratively with a wide variety of stakeholders. And we have a very strong patient-centred approach in what we do. So we have a robust clinical leadership team headed up by 2 clinical directors who are supported by a range of different clinical leads who bring expertise across a different range of areas. The clinical leadership are supported by a project management team who are mostly facilitators who are all clinicians in their own right. So we have a good MDT, including a paramedic, a therapist and an orthoptist and a nurse. And we have an administration team, and we have a recently created role around patient and public involvement. I mentioned previously we work collaboratively, and we are very keen on working well with the voluntary sector because they are an important part of the holistic pathways of care that we work to improve. So we have great relationships with all of these organisations who work at both a national and a local level. So we have a wide-ranging programme of work that spans the whole stroke care pathway and also includes neuro rehabilitation in community and longer-term support. It's through these projects we bring together key stakeholders to drive through quality improvements and really make a difference to patients' lives.
Hi, good morning. I'm Dr. Shivakumar Krishnamurthy. I'm the Hospital Clinical Director for the Stroke Network. I currently work as a stroke consultant in Stepping Hill Hospital. We are very proud as a network of our contribution and support to the transformation of stroke services in Greater Manchester. It's been a very rewarding experience for all those who are involved. The centralisation of stroke services happened in over 2 stages in 2008 and 2015, with 2015 being the full centralisation of stroke services. All stroke patients were taken to a hyperacute stroke centre where they had 3 days of specialist care and then moved to their local hospital for ongoing rehabilitation or discharged to community stroke services. The network ensured the performance of the pathway was measured and any issues dealt with. It was not all an easy ride. We had a few bumps along the way, and if I recall, the pandemic was extremely a difficult phase for the providers, and the network stepped in to support them in the operational delivery of the pathway. We can confidently say our residents have consistently enjoyed A-rated care, and our region has been performing A-rated care delivery over the last 6 to 7 years. Just to give you an example, our scan time is half of the national average. We just take 20 minutes from arrival to scan on average compared to 40 minutes nationally. And also a stroke unit stay is, the 90% stroke unit stay is also significantly better than national average. The stroke network is everybody. And without their contribution and efforts, we will not be where we are today. And I'm thankful to all those who are involved in this journey.
Hi, I'm Tracy Walker. I'm an occupational therapist. I'm lead allied health professional for Manchester Local Care Organisation, and I'm also the clinical director for the community for the network. So it's really important that people coming out of hospital or people who may already be living in the community have access to specialist community stroke rehabilitation. So people feel like when they come out of hospital they're not falling off a cliff and they've got access to all the support they may need, and also later on along the line that they've got access back to that team when needed. So over the last 8 years we've been working hard at the network to develop community stroke and neuro rehabilitation models. So this would mean that all patients are able to access a multidisciplinary rehabilitation team. So what progress have we made so far at the network? So in all localities now we've got an integrated community stroke service. We're the only region in the country to have achieved that. With regards to how that's affected people's journey, around 80 to 90% of stroke patients coming out of hospital are now transferred and referred to a community stroke service, which is around double the statistics for the rest of the country. With regards to community neurorehabilitation, we now have access to a community neurorehabilitation service in all our localities. So I'm really proud to say that in Greater Manchester we've got excellent community stroke and neurorehabilitation services compared to the rest of the country. That's been due to the huge commitment of clinicians and services across GM, so I'd like to thank them. Also the support we get from the network in training and support with meetings and reports, and also the clinical leadership and the belief in the power of clinical leadership in developing services across and leading across GM.
Hello, my name's Juliette Bouverie. I'm Chief Executive of the Stroke Association and Co-Chair of NHS England's Stroke Delivery Board. I just want to say how impressed I am by the Greater Manchester Stroke Delivery Network. It's no doubt led the way for the other ISDNs in England. You've put people with lived experience at the heart of the change, and you've also embraced the voluntary sector as an equal and genuine partner. And there's no doubt that our services can complement yours, our services can help free up clinician time, and together we can reach and improve the lives of more stroke survivors and address unacceptable inequalities.
Okay, so I'm Jo Stevens. I'm the team lead for the Community Stroke and Neuro Rehab service in Bury. When we started, we were just a stroke service. We were one of the only areas in Greater Manchester without a neuro rehab service. We approached the network, and with their help, we built a case for a neuro rehab service. They were able to help us with data collection, with benchmarking, with evidence. They have access to experts from across the region and across the country. They helped us to make our data into a business case, which we took to the commissioners, and supported us all the way through that process. Off the back of that business case, we were funded for a partial service, and that's where we're at the moment. But we continue to gather data, benchmark against best practice with their help, and continue to use the expertise to try and influence further the case for Bury to have a comprehensive community neuro rehab service. But we certainly wouldn't have one in the first place if it wasn't for the support of the network.
Hi, I'm Mike Carpenter, and I'm the chair of the Neurorehabilitation Patient and Carer Group in Greater Manchester. So the network's split across neurorehabilitation and stroke, and I represent the neuro side of things. We meet up 4 times a year to try and look at the projects that are ongoing and looking at improvements. And we have a broad range of people that are involved in that across different areas in Greater Manchester, different conditions that fall under the neuro banner. It's really important to include patients and carers in the research and the work that's happening, because ultimately we are the end users of the services that are being provided. We are the people that have to see the work that you guys are doing. We are literally the endpoints. So if you come and speak to us and sort of get our input, we're able to give you the best kind of feedback around what's working, what's not working, and where some of those gaps are. We know that a lot of these things are things that you're aware of, but if you are getting that message from us as patients and carers, then you're getting that affirmed, and there might be some things that you aren't necessarily aware of.